They call them routine checkups, but for women past 70, certain tests might actually cause more damage than benefit. You're assured it's prevention and that additional screenings extend life. Yet beneath the pristine clinics and reassuring medical professionals lies a billion-dollar industry, quietly promoting unnecessary procedures carrying concealed dangers. Radiation, inaccurate results, overdiagnosis, even hazardous treatments never actually required. The frightening reality is most senior women never learn these facts. They're trapped in endless testing cycles, worry and repeated appointments while pharmaceutical companies, private medical facilities, and insurance corporations profit enormously. Issues like persistent exhaustion, nervousness, hormonal disruption, even organ harm can stem from procedures designed to safeguard you. One examination may elevate stroke likelihood. Another might trigger permanent infections, all marketed as preventive care. Alarmingly, 2021 research showed 42% of seniors received at least one pointless test causing preventable injury. This video exposes 5 health screenings older women should question seriously, ranked from least to most hazardous. Stay for number 2 because it's universally recommended, yet might double cognitive decline risk. Have you questioned why certain tests leave you feeling worse afterward? Are you interested in what cutting-edge science reveals about appropriate screenings past 70? We're answering every comment with customized guidance. Let's begin with number 5, something your physician likely won't mention. Number 5 involves bone density scanning. For numerous women past 70, DEXA scans get ordered routinely. These measure osteoporosis, causing fragile bones. While seemingly beneficial, reality proves far more complex for seniors. By 70, bones naturally show density reduction, which is normal. Here's the problem. Research demonstrates many changes aren't dangerous enough requiring medication. A 2015 JAMA Internal Medicine report revealed over 60% of women past 70 diagnosed with osteopenia, mild bone loss, received powerful drugs causing serious complications including jaw deterioration, unexpected fractures, esophageal ulcers. Most faced no genuine fracture danger initially. These scans use T-scores comparing your bones against healthy 30-year-olds, making normal aging appear alarming. Imagine comparing 70-year-old skin to 30-year-old skin and labeling differences disease. According to 2018 Bone Journal research, women past 70 without fracture history and T-scores above -2.5 face under 3% annual hip fracture risk. Most remain safe without medication following simple strength and balance practices. Past 70 without broken bone history often skip scanning unless you've fallen or show actual fragility signs like height loss or posture shifts. When necessary, FRAX tools assess real fracture danger using multiple personal factors, providing accuracy without rushing medication. Margaret, 74, retired librarian and gardener, started bisphosphonate medication after scanning. Within weeks, severe heartburn and swallowing difficulty hospitalized her for esophageal damage. Reviewing her scan showed low fracture risk, and her lifestyle including walking, calcium-rich nutrition, sunlight already provided protection. Stopping medication treated symptoms. She's stronger and healthier without unnecessary drugs. Gentle resistance training twice weekly improves bone density up to 6% in women past 70 per Osteoporosis International studies. No scanning needed, just movement, nutrition, time. Next examines annual testing you've probably taken yearly, but it could quietly harm kidneys more than expected. Number 4 covers annual blood panels concealing dangerous kidney damage. Most women past 70 get told annual blood panels checking cholesterol, glucose, electrolytes, liver and kidney function seems smart preventive care. Regarding aging kidneys, routine panels frequently miss real danger, sometimes worsening conditions. Serum creatinine, common waste product kidneys filter, estimates kidney performance. They don't mention creatinine levels depend heavily on muscle mass. After 70, women naturally lose muscle, making creatinine appear normal despite declining kidney function. Senior women may unknowingly have stage 2 or 3 kidney disease. 2022 Clinical Journal of the American Society of Nephrology Research found standard creatinine tests missed early kidney disease in over 35% of women past 70. Researchers stressed switching to cystatin C, unaffected by age or muscle mass. When standard panels provide false security, doctors may prescribe kidney-toxic medications like arthritis NSAIDs or certain blood pressure drugs without recognizing kidney vulnerability, accelerating decline. Donna, 76, retired teacher walking 3 miles daily, complained of exhaustion and ankle swelling. Her regular panel showed normal results 2 months prior. Our cystatin C test revealed estimated GFR of 44, indicating stage 3B kidney disease, explaining symptoms and forcing medication cessation, quietly straining kidneys. Within 2 months, energy returned, swelling reduced, kidney function stabilized. Past 70, especially if thin or muscle depleted, request cystatin C testing alongside or replacing creatinine checks. It's more reliable, recommended by National Kidney Foundation since 2021 for elderly patients. Frequent blood draws cause unnecessary worry when minor abnormalities appear meaning nothing. Slightly elevated liver enzymes or marginally low sodium might trigger follow-up scans or treatments creating stress without real benefits. Older women with stable health often benefit more from symptom-guided care, medical attention based on feelings and function rather than numbers alone. Next reveals scanning marketed as life-saving yet potentially doubling memory loss risk past 70. Number 3 grows more shocking. CT angiograms after 70 mean doctors often recommend heart checkups. This scan using contrast dye for detailed heart blood vessel imaging has become extremely common, ruling out coronary artery disease, narrowing vessels, and raising heart attack risk. Used too freely in symptom-free older women, this test quietly causes harm. Procedures involve strong contrast dye filtered by kidneys. Aging kidneys are often more fragile than apparent. Improper dye clearance causes contrast-induced nephropathy, acute kidney damage. Bigger concern. 2021 Stroke Journal research found older adults undergoing multiple contrast scans within 5 years had nearly double vascular dementia risk compared to those avoiding them. Dye sometimes triggers tiny clots or alters blood flow in fragile brain vessels. Damage builds quietly over time, beginning as forgetfulness or confusion, progressing seriously while patients never suspect scanning. Teresa, 79, came after her third CT angiogram in 4 years. Originally investigated for mild exercise chest pressure, turned out simple deconditioning from winter inactivity. Each time arteries showed no significant blockages, but months after her last scan, family noticed memory lapses, mood swings, conversation difficulty. Reviewing medical history found no other clear cognitive decline risk factors, no diabetes, smoking, head trauma. Repeated contrast exposure stood out. Cognitive rehab, changed blood pressure medication improving brain perfusion helped recover some function, but damage was evident. When are these scans needed? Women past 70 experiencing clear unstable angina signs like chest pain at rest, minimal activity breathlessness, fainting spells warrant CT angiograms. For stable patients with mild or vague symptoms, safer alternatives exist. Treadmill stress tests with ECG monitoring often reveal identical heart risk without exposing brain or kidneys to contrast dye. Coronary calcium scoring, low-dose CT without contrast measuring plaque buildup, assesses long-term heart risk much gentler. Many women never learn about alternatives, trusting tests without knowing potential brain effects years later. Systems favor fast answers at what cost? Next reveals number 2, most commonly overused test in older women, still hospital-pushed despite evidence linking massive overdiagnosis and anxiety. Number 2 involves routine pelvic exams. This surprises many. Routine pelvic exams including manual uterus, ovary, vaginal canal checks still performed on millions of women past 70 annually, even symptom-free with no risk factors. According to 2017 U.S. Preventive Services Task Force recommendations, no solid evidence shows these exams in symptom-free women reduce cancer deaths or improve outcomes. They cause real harm. Pelvic exams produce false positives, findings appearing abnormal but harmless. These trigger chain reactions of ultrasounds, biopsies, sometimes surgeries, all carrying risks. For older women, risks magnify due to age-related vaginal tissue thinning, increased post-procedure infection risk, slower healing. Archives of Internal Medicine research found 63% of women past 65 with routine pelvic exams underwent at least one follow-up test, revealing no significant condition. Many follow-up procedures uncover incidentalomas, small benign growths or cysts never causing symptoms or shortening life. Once found, they create anxiety. Many women feel pressured acting even when best options involve simple monitoring. A leaner, 75, former chef came after routine pelvic exam detected small ovarian cyst. Her doctor ordered ultrasound, CT scan, finally recommended surgery just in case. She proceeded fearing cancer. Mass proved harmless fluid-filled cyst, common post-menopause. She spent 5 hospital days with complications, needed 6 weeks recovering from unnecessary surgery. Emotional toll equaled physical damage. She felt like ticking time bomb discovering no danger existed. When are pelvic exams needed? Older women with specific symptoms like pelvic pain, abnormal bleeding, pressure require this important tool. Women feeling well without complaints, especially those with hysterectomies or completed cancer screenings, gain little benefit facing more stress than clarity. Better approaches use symptom-guided strategies where exams and scans occur only when reasons exist. If needed, transvaginal ultrasounds offer detailed imaging with less discomfort and risk. Newer blood tests like CA-125, while imperfect, help evaluate risk without jumping to invasive procedures. Number 1 is most aggressively promoted yet may quietly harm memory, gut health, even raising sepsis risk without warning seniors. Colonoscopy after 70 gets described as gold standard cancer screening, widely recommended, heavily marketed, considered routine passage at 50. By 70, especially with prior clear screenings, this test may quietly do more harm than good. Colonoscopy inserts flexible camera tubes into colon seeking polyps, small growths sometimes becoming cancerous. Doing this safely requires completely emptying colons using powerful laxative PrEP. This unravels older adults. PrEP solutions extremely dehydrate, flushing digestive systems entirely, removing waste plus electrolytes and beneficial bacteria, maintaining gut health. In older women whose hydration reserves already run lower, rapid flushing causes dangerous blood pressure drops, kidney strain, electrolyte imbalances. 2016 American Journal of Gastroenterology Research found nearly 28% of patients past 70 experienced moderate to severe dehydration after colonoscopy PrEP, causing fatigue, dizziness, sometimes hospitalization. Bigger danger comes afterward. Colons house trillions of bacteria forming gut microbiomes supporting immune health, hormone balance, even brain function. After colonoscopies, especially with polyp removal, microbiomes disrupt for weeks, weakening gut barriers, keeping harmful bacteria from bloodstreams. If barriers fail, Sepsis opens. Life-threatening body-wide infection. 2019 BMJ Open reports showed older adults had 12-fold increased sepsis hospitalization risk in 10 days following colonoscopy with biopsy compared to general populations. Many cases involved people without prior symptoms undergoing purely preventive measures. Then anesthesia issues arise. Most colonoscopies use sedation for comfort. For adults past 70, especially those with pre-existing cognitive vulnerabilities, anesthesia links to short-term delirium and long-term memory decline. 2020 anesthesia and analgesia research showed 41% of seniors experienced measurable cognitive changes after outpatient anesthesia persisting at least 1 month. Joan, 81, retired piano teacher loving crosswords and storytelling, had clean colonoscopy at 72, but her new doctor pushed another for safety. Prep left her weak and dizzy. 2 days later, fever and confusion developed. She was hospitalized with sepsis, stayed intensive care 4 days. Even after recovery, her daughter said she was never quite the same. Memory slipped, appetite declined, worst part, test found nothing dangerous. When are colonoscopies truly needed? Women past 70 never previously screened or with concerning symptoms like rectal bleeding, unexplained anemia, chronic digestive pain still benefit. Women with past negative results and no current symptoms, especially good health with life expectancy under 10 years. Major guidelines including U.S. Preventive Services Task Force recommend stopping routine colonoscopy screenings. Safer options include non-invasive stool tests like FIT detecting hidden blood done at home. These tests, recommended annually for qualifying seniors, show high colon cancer detection rates without sedation or prep risks. 5 health checkups older women get told taking after 70 may do more harm than good used blindly. Bone density scans, routine blood panels, CT angiograms, pelvic exams, colonoscopies all have appropriate places but only used wisely, not just routinely. Each test has power helping or hurting depending on timing, context, whether your body truly needs it. Most powerful medicine isn't machines or tests, but personalized care based on symptoms, risks, conversations with doctors understanding aging. Have you or someone loved ever regretted getting unnecessary tests or procedures? What health decision are you glad you questioned or researched first? Drop answers in comments. We're reading and replying to every single one with personalized tips and advice guiding you forward. Your story could save someone's life. Thanks for watching.